Hi, I'm Dr. Martin Rutherford, certified functional medicine practitioner and chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
Sorry. Sometimes I can't remember the name of the topic, so I want to just jump right in there. Is fasting weight loss, or is it something else? Spoiler alert, it's something else.
Yeah.
So today I'm Dr. Martin Rutherford, and we do we have a, for those of you who haven't seen us, we do we have a I touched it today. I've had a long 9 days here. My brain is flagging. For those of you who've watched this, don't do what I just did. If you have concussions and autoimmunity and stuff like that, you need to do some fasting before you do one of these things. So today, that gets your brain nice and clear, which probably leads partially to the topic that we're going to talk about. That was that whole aside. So today, we have a chronic pain clinic. We do a lot of chronic pain, a lot of neurologically based conditions, and within the framework of that protocol, there's a lot of nutritional protocols and supplementation, and we do brain rehab exercises. Fasting has found its way into our protocols, and it has proven to be a valuable tool in a lot of different ways. For those of you who don't know us, we only present things here that we've seen, we've utilized, we've seen the effects, and been able to determine where they're effective, where they're not, at least within the framework of our practice, and we're here to share them with you. So fasting has been around forever. It's something I used to do, and I probably should do more of. I used to do it every Monday. I used to fast, and it turned out to be a really good thing. Today's program might answer some of the questions as to why that is for me, and other ways that it could be used in the framework of your daily activities, or if you have chronic conditions, or if you have some sort of brain foggish type of a condition or other types of things, how these things might be affecting you other than just not eating and losing 5 pounds or something like that. So I'm kind of really interested in this too.
Mm-hmm.
Actually went to a seminar this weekend where he talked about fasting a little bit, and it brought a little bit more clarity to me. And I'm interested to hear what you're doing out there, because Dr. Gates does all the treatment here, and he's the one who gets to see instantaneously what the results of these protocols are. So fasting.
Yeah, with fasting, also referred to as restricted eating times, a lot of, you could say, naysayers would tout that the effects of fasting were just due to the weight loss. So they found that it really is not. They're finding that with the fasting, a lot of downstream biochemical pathways are changing, like we would presume, because Americans have shifted to this high-fat, high-calorie, high-carbohydrate diet that conditions our microbiomes, and we're always teaching our body to secrete insulin. That's what we're teaching our bodies. Ironically, human physiology is designed to starve, as we mentioned many times in other broadcasts. And so your body is actually designed to go into starvation states for long periods of time, because there's argument that that's probably how humans ate for many years, leading up to whatever. The Earth
Didn't
is
have any
5,000
food, didn't
years
have any
old,
food, didn't have any food,
or
and
the
then-
Earth is however many millions of years old. So that's the argument in terms of fasting. And we talked about fasting last week relative to stem cell function. We've talked about gastric bypass. One of the main ways gastric bypass works is not via caloric restriction, but it bypasses the small intestine, a lot of these procedures. And your small intestine is where a lot of these inflammatory rogue bacteria are that have they may release abnormal inflammatory pieces of bacteria. They signal with your liver in a very pathogenic way. And so by doing a gastric bypass, lots of times you can circumvent that issue. Although one other argument is, well, why don't we just start fasting? And I will say that with fasting, we don't see as dramatic results
as the bypass.
As somebody who gets a gastric bypass
course,
or gastric sleeve. But it does produce a long-term, slow change. And I think it's a pretty cool thing. And our whole mantra is less supplements is better. we don't start people fasting when they're going into our program. I mean, everything out there is the shotgun approach, like we talk about every week, to where, go on the keto diet, like we were mentioning. The keto diet's the new paleo diet. Like paleo was so cool a couple of years ago, 2 to 3 years ago. Now it's keto. In a couple of years, it'll be something else. But there's a time and a place for each different diet. But with fasting can be really fantastic for a lot of patients who have insulin sensitivity issues, which is at least about 40%, actually about 43 to 44% of the population. So, significant percentage. Either has diabetes or pre-diabetes. I'm not even counting people who are just kind of classified as being overweight. So yeah, I think fasting's a good thing. And I don't know if you want
And you're talking about like short-term fasting, long-term fasting. People will ask me, do you do a water fast? I mean, fasting's a pretty sophisticated subject in and of itself.
Right.
I did a 10-day water fast one time just to see what it was like, and the first couple of days were grueling, terrible, awful. I felt terrible. I did it, honestly, I was reading a Chinese medical book, and I did it just to see what it was like. For those of you who don't follow us or if you've never seen us before, I've got a lot of autoimmune problems. That's how we got into this: fibromyalgia, peripheral neuropathy, chronic fatigue, celiac, Hashimoto's thyroiditis. I have confirmed all those, and so I have to follow the rules that we give to our patients. And so I was always poking and prodding at the time, not knowing I had all that, but knowing there was something wrong. And fasting kind of was interesting. I was reading a Chinese medical book, a lot of things in that book, which I follow to this day, breathing techniques and stuff. And fasting struck me. So being the anal left brain Virgo that I am, I jumped right into a 10-day fast. And the first 3 or 4 or 5 days, maybe one of the reasons that people don't do it is because you feel like you want to kill yourself. It's, I guess toxins are being released. There's theories on that. But certainly we now know that the microbiome is altered dramatically. My microbiome was not good at that point in time, that's for sure. But at that 5th or 6th day, it was like somebody just turned a switch. And it was amazing. I had seborrheic dermatitis, gone. I had skin lesions, if you want, around here, that classic dryness, cheilosis around the ear, gone. My teeth, which were bleeding, stopped bleeding. My bowels, of course, were fine because apparently the bacteria were starting to normalize. My thinking became, I remember the clarity with which I was thinking. So there's probably an anti-inflammatory, and immune dampening response to it, I would think, to some degree. And so most of our patients that come in, including me, you'll hear me say, our people around here will hear me say, if I never had to eat again, I'd be fine. Because on those days that I don't eat, once I get past the blood sugar ups and downs and stuff like that, I feel pretty good. But I hear my patients say that a lot. They say when things happen, even when I've gotten sick, even when I've gotten sick for 2 or 3 days and you don't feel like eating, and then all of a sudden there's a shift in your microbiome, and all of a sudden it's like, wow. When I'm not sick, I'm going to be just like this. I'm just going to eat very little. I'm going to eat light. I'm not going to eat very much. And then you're not sick anymore, and your hunger comes back, and you do that. But I think fasting, that you use it for, I know it's used, I think you use it for, well, I don't know. I think I know what you use it for, but if I say it and then you say no, you're going to make me look like an idiot. So what do you use it for? Like I think breaking the as people are losing weight, to like reset their system, if they hit a wall.
We definitely use it in that circumstance, especially for blood sugar issues. We've had a lot of success with the properly selected person, with helping their blood sugar issues, diabetes. People
which kind of go together.
Type 2 diabetes, so people who may be taking insulin, who are very insulin resistant, other diabetes medications. We've had a lot of success with that, but then integrating the fasting with our protocols has been very illuminating in terms of what can be done in terms of blood sugar. And a lot of these are dietary illnesses that are facing Americans, from diabetes to thyroid to all these neurological diseases. So if it started with diet, we should be able to at least affect some change.
Yeah, and then you might want to look at
strategies.
some of our presentations on the gut, and we have a 5-part series on weight loss. But in there, it explains how the gut can affect weight loss and relative to the microbiome and some of the bacterial aspects of it that Dr. Gates previously mentioned. So fasting has been around forever. As Dr. Gates said, it may have been the natural state of mankind. You know, you have people foraging, you have people hunting. There's not probably not a deer out there every day for them or whatever it was that they were hunting at that point in time. And his comment on we're made to control our blood sugar is a very, very important point to embrace if you can really grasp that. It is a big deal to understand that is what your body's trying to do all the time, and it leads to a lot of other things. And then fasting really, really affects that to a large degree. So, okay.
I mean, I even want to interject just
Please.
an anecdotal story. I don't know if it's an anecdote, but just a story that my grandmother told me. And the Native Americans from Bishop, you know where Bishop is. Bishop is...
Yeah, your favorite place.
Yeah, my favorite place, and it's 4 hours south of Reno. And the Native Americans would take pine nuts from the Owens Valley there in Bishop and hike all the way over the Sierras. And these peaks are like 13 to 14,000 feet.
Right.
I hiked one of them, and you know, it's this whole ordeal. You have this 50-pound backpack, you have all this water,
Yeah.
all these supplies. And they would regularly hike the Sierras directly over into the San Joaquin Valley to trade for acorns. So, you know, if you put yourself in their shoes, who knows what they're actually eating, but it gives you some concept that they're trading pine nuts for acorns. That's what human beings were eating and subsisting off of versus, you know, a number one at McDonald's, which is really good.
Right.
So.
Yep. So fasting, it's really, really very little about weight loss, and it's about a lot of other things. And so it's something to look into, something to maybe study a little bit more, look into it. There's a zillion types of fast. My advice to you is keep it simple if it's something that you're going to explore. And hopefully that is some interesting data, some valuable data. It's more of a tidbit of what we see relative to some of the tools that Dr. Gates has to use to get people from A to B with their chronic pain and their weight loss and a number of other things. So hopefully we've sparked your interest in it. Follow up on it. I think you'll find that the investigation will be fruitful.
Mm-hmm.
All right?
Yeah. Thanks for watching. Go to Power Health Talk for any questions.